Root canals, the dreaded word of dentistry. Oh, that's the one, I'll tell you, that's the one that everybody wants to know about. What is a root canal? Why do I hear such terrible things about root canals? My name is Dr. David Shannon. I have a dental office in Northridge, California, on Nordhoff Street between Tampa and Reseda Boulevard. And I am going to set you straight on what a root canal is and why is there so much fear and bad karma about a root canal. So I'm going to take you back a little bit in time to when people didn't go to the dentist on a regular basis. The dentist was just somebody that was there for emergencies. And that's what we did. We did emergencies. And so there was a lot of extractions. We pulled a lot of teeth out. But with time, dentistry started figuring out there's a way to save teeth. So the root canal was invented to save a tooth. Unfortunately, before I explain root canal, I have to tell you why people came to the dental office. At that time, it was an emergency. Instead of having the tooth pulled, they were told there's an alternative. You can save the tooth. Well, everybody wants to save the tooth. It's better to save it than to pull it. You don't want a space in there. You don't want to start losing teeth. You want to be able to chew and eat. They said, okay, fine, let's save the tooth. That's what a root canal was. Unfortunately, it was pain and it was swelling and there was a lot of symptoms, a lot of things going on in your mouth. Maybe pus was draining. You had this terrible taste in your mouth. That tooth was in really bad shape. And so saving it with a root canal was going to do two things. It was going to save the tooth, but it was also going to heal your body. Now, the healing process is what I want to focus on now. How do you heal it? Well, let's jump ahead and say the root canal is finished. But if the tooth was infected, if the bone was infected, if there was a pus pocket up in the bone, that bone was really in bad shape. And it takes a long time for bone to heal. And that's where the fear came from relating to root canals. Because the root canal seemed to be causing the pain. But it really wasn't. The pain was there and it was taking a lot of time for the swelling and the pain to go away to allow the body to heal itself. So if a root canal is needed on a tooth, it's best to get it done right away and not to wait for it to hopefully miraculously heal itself. You have to take that step. You have to be in charge. You have to be in control of your own body and your own future, and you have to say, okay, I'll do the root canal. So now I can tell you what is a root canal. So a root canal is when bacteria get into the tooth because of a decay. You have a big cavity that you just haven't gone to the dentist to get filled. Food gets stuck in that hole in your tooth, and eventually bacteria get down into the nerve. The nerve becomes infected. At the beginning of that infection, it might be a little hard to chew on that tooth. Maybe it's a little sore. Maybe it's a little sensitive to cold or to hot. So in your mind, you're hoping, oh, I hope this goes away, and you ignore it. You take some aspirin, you go about your business, you make up excuses, you say you're too busy to go to the dentist, whatever it is, you put it off. Well, instead of putting it off, if you go to the dentist at that point, and he tells you you need a root canal, the infection hasn't gone through the bottom of the tooth. It hasn't gotten into the bone. It hasn't traveled through the blood vessels into other parts of your body. It hasn't created fancy infections that need specialized care and specialized medication and long periods of time to heal. If you get it at the right time, it's a one-visit procedure. The tooth is cleaned out, the decay is removed, the bacteria is flushed out with a little rinsing out. The root becomes a hollow tube, very similar to an old pipe that's in your backyard, and you don't want to leave that old pipe open. You want to fill it up because you don't want rats and you don't want bugs and stuff living in that tube. So you in that piping in your backyard. So you fill it up with cement. And once it's filled up, you leave it in the ground. You don't have to dig up your swimming pool. You don't have to dig up your garden. You don't have to dig anything up. Just leave it under the ground. Nothing can live in that empty space because it's not empty anymore. It's filled with cement. Well, it's the same thing with the root canal. After it's cleaned out and all the bugs are removed and it's rinsed out, the root isn't extracted. A root canal doesn't mean we're taking the root out of your jaw. We're leaving the root in. It's healthy. It's strong. It's good to be there. We're just putting a medicine in there that's like a rubberized, soft plastic material that goes down into the center, it seals it off, and it closes it so we can put a cap or a crown on top of the tooth so your tooth is normal and healthy. And when you look at it on an x-ray, there's your root. It's still there. It's just the hollow part in the middle where the nerve was is now sealed with a plastic sealing material. And that's what a root canal is. And if you face it, and if you step up to the dentist by going on regular visits, or as soon as something breaks or cracks and you don't put it off, that root canal is just a simple procedure that takes about an hour to do, and everything is fine after that. So allow yourself to think in the present time, allow yourself to think in the future. Don't think about what it was 70 years, 50 years ago when a person needed a root canal, all those horror stories you heard. Think about the technology we have today and step up and get it taken care of, because you're in control of your health. You're the one who can make your mouth healthy and therefore make you a better person. And I hope this video was helpful for you in allaying some of the fears of the past. And we have many more videos on different subjects. Feel free to browse through our website that's here on the bottom that's listed. Call the phone number and speak to our office. You're more than welcome to come in for a consultation at no charge. We'll be more than happy to explain your condition, because the knowledge of your condition, of what you have, the more you know, the better choices you can make on a healthy, happy future. Thank you.